Welcome, my friends. Let's talk about something that is keeping so many of you up at night, and quite frankly, it makes my blood boil because it shouldn't be this hard. You work your entire life, 40, 50 years, paying into a system. You reach that magical age of 65, or you are staring down the barrel of retirement, and you think, finally, my health insurance is secure. I have Medicare. But then, reality hits you right in the face. You need to see a doctor. Maybe your back is acting up, maybe it's time for that annual screening, or heaven forbid, you get a diagnosis that scares you to your absolute core. You pick up the phone, you call the best physician in town, and what do they tell you? I'm sorry, we aren't accepting new Medicare patients. Or worse, we don't take Medicare at all. Can you feel that pit in your stomach just thinking about it? It is a paralyzing fear. It is the fear of being stranded in your golden years without the medical care you rightfully earned. You start wondering, am I going to have to drive 50 miles to see a doctor? Am I going to be forced to go to an urgent care clinic where nobody knows my medical history? Am I going to have to pay out of pocket and wipe out my retirement savings just to get a prescription filled? Listen to me closely, your health is your greatest wealth. If you do not have your health, you do not have your retirement. Period. And the idea that you have to spend your days stressed, confused, and begging a doctor's office to see you is unacceptable. So today, we are putting an end to the confusion. We are answering the big, looming question, how do you actually find a high-quality doctor who accepts Medicare in your area without losing your mind or your money? To solve this problem, we first have to understand why this nightmare happens in the first place, because knowledge is power. There are two entirely different ways people get their Medicare, and if you don't know which camp you are in, you are flying blind. First, there is Original Medicare, which is Part A and Part B. If you have Original Medicare, you can theoretically see any doctor in the United States who accepts Medicare. Sounds simple, right? But here is the catch, and this is where people get hurt financially. Doctors who participate in Medicare fall into different categories. Participating providers accept what is called assignment. That means they agree to accept the Medicare-approved amount as full payment for covered services. You pay your 20% coinsurance, and you are done. Now, let's look at the second camp, Medicare Advantage. These are private insurance plans, like HMOs or PPOs, that manage your Medicare benefits. If you chose a Medicare Advantage plan because you like the extra bells and whistles, you need to understand that your world is restricted by a network. If a doctor is not in your specific plan's network, they might as well be on Mars. If you go out of network on an HMO, the plan pays zero. If you are on a PPO, you will pay a massive premium to see that doctor. When you get to that tool, you type in your zip code and the type of doctor you need, whether it's a primary care physician, a cardiologist, or an orthopedic surgeon. The tool will give you a list of every doctor in your immediate radius who is registered with the program. It will tell you their address, their phone number, and their specialty. But remember what I always say, a tool is only as good as the person using it. Just because a doctor is listed on Medicare.gov does not automatically mean they are taking new patients today. It is a starting directory, not a guarantee. Thankfully, the government made a massive upgrade to the Medicare Plan Finder tool. It now integrates private Medicare Advantage provider directories directly into the main system. This means if you have a private Medicare Advantage plan, you don't have to bounce around 10 different insurance websites to see if a doctor takes your specific plan. You can see it right there. It even shows you the in-network and out-of-network cost-sharing, prior authorization rules, and plan limits. Use this upgraded data to your advantage. Once you have your list of potential doctors from the website, you move to step 2, which is the validation phase. You must pick up the phone. Do not assume anything. When you call the doctor's office, you have to be incredibly precise with your language, because the person answering the phone might be a temporary receptionist or someone who doesn't understand the nuances of insurance. Do not ask, "Do you take Medicare?" That is a dangerous question. A doctor can take Medicare but be a non-participating provider who charges you that extra 15% limiting charge. Instead, if you have original Medicare, you ask this exact question: is the doctor a participating provider who accepts Medicare assignment for new patients? Write that down. Accepts Medicare assignment. That phrase is your financial shield. It means they accept the government rate as payment in full, and your wallet is safe. If you have a private Medicare Advantage plan, do not just ask, do you take Aetna or do you take Blue Cross? These insurance companies have hundreds of different plans. A doctor might take an Aetna PPO but refuse an Aetna HMO. So when you call, you hold your insurance card in your hand and you say, "Are you an in-network provider for my specific plan, which is?" And then you read the exact name of the plan printed on your card. Ask them to verify it with their billing department before you schedule an appointment. Now, what happens if you do all of this, and you still can't find a primary care doctor in your town who is accepting new patients? This is a very real problem in many parts of the country right now. If you hit a brick wall, do not despair. You look for alternatives within the system. First, look into advanced primary care management services. Medicare now expands funding for these programs, which coordinate and tailor care specifically to your needs, giving you 24/7 access to a care team. Ask local clinics if they offer this specialized Medicare management. Second, consider looking at community health centers or federally qualified health centers. These are community-based clinics that receive federal funding to provide care in underserved areas. They absolutely accept Medicare, they often have excellent practitioners, and they are required by law to provide comprehensive services. You have earned these benefits. Now, protect them.